Babesia isn't just for the immunocompromised. I'm Dr. Cameron. This is part of a Common Sense Lyme series where I discuss questions and cases that come up in my practice. So let's begin. Now, the patient asked, why am I still sick if I've already been treated for Lyme? She was told Babesia only matters for immunocompromised patients, but her story told a different truth. There's a common myth that Babesia only causes symptoms in immunocompromised patients. In reality, symptomatic patients can occur in healthy individuals, and I see that all the time. The literature even says that many cases don't end up being immunocompromised. Some of them say they're elderly, but I haven't seen this need to look for immunocompromised patients. And some patients who I've seen with Babesia end up chronically ill, and they only break their chronic illness if they get treated for Babesia. So what is Babesia? It's a tick-borne parasite that infected red blood cells. It's a co-infection with Lyme disease. It can make Lyme disease more severe and more difficult to treat. And that was first discussed by Dr. Krause and was published more than 20 years ago. The common Babesia symptoms are night sweats and air hunger, fatigue, brain fog, mood changes, and dizziness. Pretty much the same symptoms you might see with Lyme, except that since it's a parasite, for some reason, some people end up with air hunger where they really can't measure it, but they have a sense of not catching their breath. This has nothing to do with exertional shortness of breath. Half the patients get sweats and half don't. Now, I should mention that Babesia is quite different if you catch it during the first week when you're in the hospital intensive care unit and you got Babesia parasites in the red cells, you got hemolysis, they're deathly sick. I'm talking about Babesia where they're not in the hospital. There are even Babesia patients who are free of symptoms. They donate blood. The recipient gets the donated blood and ends up with Babesia. So it can be a range from severe sick to not so sick to no symptoms at all. My patient turned around once she got treated for Babesia, which suggests that you can't rule out Babesia just because she's not immunocompromised. If Lyme disease treatment fails, I always think of co-infections, and the right diagnosis changes everything. Thank you for joining me for this Common Sense Lyme Disease series. If you have any questions, leave those in the comments below. And have a good day.